Hello, welcome back to the channel. Thanks for being here. Today we've got something you really need to hear, especially if you care about healthcare in this country. Please make sure to listen to the end so you can hear all the verified sources and confirm this news for yourself. And if you haven't yet, just hit that subscribe button, it's free and it helps us keep going. Now let's get into it. There's a serious warning coming from the Gauteng Department of Health, and they're not mincing their words. They've raised the alarm that if foreign nationals are blocked from accessing public healthcare services, South Africa could soon face a massive public health disaster. They're especially worried about communicable diseases, the kinds of illnesses that spread fast and don't ask for passports before jumping from one person to another. You might be thinking, but aren't our clinics and hospitals already overwhelmed? Yes, they are. But here's the thing, the department is saying that preventing access to healthcare based on immigration status could actually make things worse, not better. Imagine people with TB, measles, or even COVID-19 being unable to get treated because they're undocumented. That means they'll just walk around, untreated, and spread those illnesses to others, including legal residents, South African citizens, children, the elderly, and the vulnerable. The spokesperson for the department explained that South Africa, like many other countries, is part of international agreements that say healthcare should be a basic human right. This is not just about being nice, it's about practical survival. Diseases don't respect borders. They don't stop at Otambo and say, "Wait, do you have a visa?" No, if someone's sick and contagious, they pose a risk to everyone around them, regardless of nationality. And here's where things get even more concerning. The department says if clinics start turning foreign nationals away, people will delay seeking help until they are extremely ill. That not only puts the individual in danger, it also increases the cost of treating them when they finally arrive at a hospital in a critical state. It's more expensive to treat advanced TB or late-stage HIV than to catch it early. This statement comes at a time when there's a lot of political heat around immigration and public services. Many citizens are frustrated. They feel like they wait for hours in public hospitals, only to be told there's no medicine, or the doctor is off, or the queue is too long. And it's understandable, nobody wants to feel like they're being neglected in their own country. But the department is saying, let's not turn this into a public health crisis by punishing people who are already desperate. Denying healthcare won't fix the root of the immigration system or border control issues. It will just lead to more outbreaks of diseases, which will eventually come back to affect everyone. Now, whether or not you agree with allowing undocumented immigrants into our clinics, the Gauteng Health Department is asking the public to think about the bigger picture. They're not saying ignore immigration laws. They're saying we need to approach this carefully, because pushing vulnerable people away from healthcare might be creating a bomb we can't defuse later. And look, they're not the only ones. Several medical experts and human rights groups have backed this statement, warning that any policy that excludes groups from access to essential health services opens the door to disaster. One doctor even said, "A virus doesn't ask who you voted for before it infects you." So while the country debates immigration, border control, and the strain on services, this warning from the Gauteng Health Department should not be taken lightly. It's a reminder that we're all connected when it comes to health, and that prevention really is better and cheaper than cure. All the images used in this video are just for illustration purposes, no real patients or clinics were filmed for this. At the end of the day, it's about making sure everyone in South Africa, regardless of background, is protected from the spread of disease. The sources used for this news include ENCA, Times Live, Gauteng Live, and SABC News. You can check their latest reports to confirm what we've shared today, all based on real, current updates. Thanks for watching. Don't forget to like the video and subscribe to the channel. And if you've got something to say about this, go ahead, the comments are open. Just keep it respectful, Annie. And to end on a lighter note, one nurse said, if the virus starts asking for ID, then I'll start doing it too. Yo, even the viruses are undocumented these days. Stay safe, Mzansi.